is Dr. John Van Wagner. I'm one of the physicians here at Southwest Allergy and Asthma Center. I want to share with you some great information about one of the most useful tools we have here at our office. We are one of only a handful of allergy offices in the state of Texas that has in-office CT scanners in our offices. In fact, we have CT scanners in 3 of our 4 conveniently located offices. Our CT scanners are found in our Plano office, our McKinney office, and our Denison office. We soon will have one in our Allen office. What is so exciting about having a CT scanner in our offices? Let me share with you a number of reasons that makes a difference. Acute and chronic sinusitis is one of the most common conditions seen by primary care doctors in allergy and asthma and immunology offices. Because sinusitis is so common, having the scanner available to review whether you in fact have sinusitis is very valuable. Sometimes we even use the scanner to verify that your sinusitis has resolved. Because the scanner is so safe, we feel very confident that the amount of radiation you will be exposed to is exceedingly small. The majority of the scans we do in our office use a very small dose of radiation, probably similar or less than the dose of radiation you get exposed to with a chest x-ray, a very common and safe radiological exam. Many patients with sinusitis suffer from structural issues in the anatomy of their sinuses. Having a CT scan available to ensure your anatomy is normal and not contributing to your sinusitis is important in your sinus evaluation. Many times we find other issues in the nasal and sinus structures that may be playing a role in your sinus disease. Some of these issues may be a nasal polyp or a sinus polyp, mucocysts, mucoceles, bony deformations, adenoid enlargement, to name a few. Our scanners provide point-of-service results. We're able to look at your images that are computer generated of your sinuses in less than a minute of your scan. Our typical scan of your sinuses typically lasts about 10 to 20 seconds. Being able to review the images with you at the time of your visit is so very helpful. When I can show you the problem and explain to you why and or what is wrong with you, the more educated you will be regarding your health. We can perform CT scans in children as young as 2 or as old as 102. Because it is an open scanner that does not require you to lay still or even lay down, it's even more patient friendly than the scanner you may find at the hospital or at a radiology office. Let me show you how a scan is obtained. So typically what will happen is we'll bring a patient back, and this is our CT machine, and the patient's going to sit down in our nice chair here, and typically what happens is they'll just sit in the chair nicely, and we'll hold the head back in this holder right here, and we'll usually put a strap around the forehead, and the patient just needs to sit here still. And so what will happen is when I'm over here on the other side, I'll turn the button on, and what will happen is the CT machine will start to rotate around my head. So really slowly the scanner will go around your head about once or twice, and then we're done. And so at the end, we're going to look at the images of what a CT machine captures when it looks at my sinuses in a computer-generated fashion. So I'm going to show you those images here in a minute. Let me now show you what kind of images we receive when we do a CT of your sinuses. Now, what I've pulled up is a CT scan of my head, and so I'm the patient here that's received a CT machine scan. And so I'm going to go through with you kind of some of the images that we see. Now, as you can see here, bone shows up as white on the scan. So just like what you've known, when you see a bone, it's white. The bone structure here is all white. Now the black indicates air in the sinuses. Gray would indicate soft tissue, like your eyeballs or your brain. This right here is a front view, or what we call a coronal view of your sinuses. Over here on the right side is what we call a sagittal, or a side view of your face image. And right here is called an axial image, kind of an upside down view of your sinuses. So what I'm going to do now is I'm going to kind of rotate through some of the images so you can kind of see the detail that we get with the CT machine in the scanning process. So as I take a slice, for instance, across my face here, you'll see the tip of my nose. And as I work my way deeper into my face, across the face, different structures show up. So as I said, bone is white. Here's the skull in the white, the air is black, and here's my right eyeball, and here's my left eyeball. Here's my nasal septum, and as I keep on going down deeper in my face, you'll see I have a nasal spur that goes to the right, and this is left. And so I have some bony deformation of my nose septum right there. These things that hang down in your nose are called turbinates. You have middle ones and you have small lower ones. My maxillary sinuses are open and clean. They're filled with air and all the black, and they drain right through this little opening right here called the osteomeatal complex. And you have one on the right side and on the left. There's sinuses in between the eyeballs. There's sinuses above the forehead, and there's sinuses in the middle of the head called the sphenoid sinus. And so really I can take a peek at all the sinuses all at once with this CT generated image. So it's fantastic, the clarity that you see with the images. I can go from side to side and look at very close detail of some of the different structures that we have on the CT. I can sometimes look at the throat. Here's the back of my nasal palate, and I don't have any adenoids any longer, but for some kids they have huge adenoids, and we can see that on the CT images. So I find the CT machine a very useful tool. I think the images are somewhat self-explanatory when it comes down to interpreting the images. I look forward to helping you. If you need a CT of your sinuses, we have one in our offices, and we can go through that with you and get that done very quickly. Thank you for watching this video.